Mood disorder is a psychological disorder identified by the elevation or lowering of an individual's mood. This means if you have any kind of mood disorder, your emotional state will be inconsistent and most likely will interfere with your capacity to function. Today, we will be introducing the most common mood disorders such as major depression, bipolar 1, bipolar 2, and psychosis.
Major depressive disorder, also known as depression, is a mental disorder characterized by at least 2 weeks of low mood. It is often accompanied by loss of interest in activities that the person used to enjoy before, low or lack of energy, helplessness, unfeeling guilt or regret, and low self-esteem. Other symptoms of depression include poor concentration and memory, withdrawal from social situations, reduced sex drive, irritability, insomnia, or oversleeping. Thoughts of death or suicide are also common. Appetite often decreases, with resulting weight loss. However, increase of appetite and weight gain may also occur in some cases. Patients may also be described as clingy, demanding, dependent, or insecure. Diagnosis may be delayed or missed when symptoms are interpreted as normal moodiness. Major depression considerably affects a person's relationship with family and friends, work, school life, and health in general. Furthermore, it frequently co-occurs with other mental health disorders, such as anxiety. Anxiety symptoms can have a large effect on the progression of depression, with tardive recovery, increased risk of relapse, greater disability, and increased suicide attempts. Depression is often combined with alcohol, drug abuse, or personality disorder. The cause of major depression disorder is unknown. It is believed to be a combination of genetic, environmental, and psychological factors. A diagnostic assessment may be conducted by a properly trained general practitioner or by a psychiatrist or psychologist. Behavioral interventions such as interpersonal therapy and cognitive behavioral therapy are successful at preventing new-onset depression. There are numerous treatment methods for major depression disorder, which include psychotherapy, antidepressant medications, electroconvulsive treatment, ECT, and other somatic therapies. However, ECT is generally avoided, except in extreme situations. Both psychotherapy and antidepressants are frequently used methods, which differ for each person based on individual needs. People who believe they have depression or know someone who may have depression should seek professional help.
Bipolar 1 disorder, also known as manic depressive disorder or manic depression, usually consists of patterns between mania and depression episodes, where a maniac episode is defined as disruptive and abnormal feelings of extreme energy that are usually out of control. And a depressive episode consists of low mood that includes heavy feelings of sadness and a lack of interest or enthusiasm that also interrupts normal daily activities and lasts several days. Someone that is considered to suffer from bipolar 1 disorder has had at least one manic episode, which can present in symptoms such as euphoria, extreme energy, irritability, excessive spending of money, hyperactivity, endless need for sleep, substance abuse, abrupt change of ideas, and overconfidence. During these episodes, the person may come up with unrealistic plans or set goals that are not pursuable, and may confuse what is real with what is not. A person who has bipolar 1 disorder will most likely experience manic episodes more often or intense than depressive episodes. Anyone can suffer from bipolar 1, but it can be treated in order to control the depression episodes and severe manic episodes, which is mainly what differentiates bipolar 1 disorder from bipolar 2 disorder. The treatments provided for bipolar 1 vary in dosage according to the symptoms presented. These medications include mood stabilizers in order to control the manic episodes, antipsychotics provided by psychiatrists, antidepressants which are added to the treatment to help manage depression, and or antidepressant antipsychotics, which is a combined medication that helps as both a mood stabilizer and as a depression treatment.
Bipolar 2 disorder is a form of mental illness. It is defined as a dramatic shift in moods, emotions, and energy, a cycle between highs and lows over time. It is important to understand the difference between bipolar 1 and bipolar 2. Bipolar 2 disorder refers to the lows or depressive phases. It is more often seen in young adults from the age of 18 to 25, and it is mainly classified as hypomanic depression. Individuals suffer from major depressive disorders, and it can be identified by actions and state of minds where they feel hopeless and discouraged, they have lack of energy and difficulty to focus, and physical symptoms involve eating and sleeping too much or too little. The difference of bipolar II disorder and unipolar depression is that bipolar II disorders has up moods that never reach its highest. These are called hypomanic episodes, where it involves being energetic, overly happy, optimistic, euphoric, or to be overly confident. Such symptoms seem positive, but when someone suffers from this disorder, the symptoms could reach a dangerous extreme. Individuals could spend money they don't have sex with someone they normally wouldn't, and engage in impulsive and risky behaviors that could be the cause of delusion. The question is, who is at risk? 2.5% of the US population suffer from some form of bipolar disorder. Its symptoms usually starts in their teens or early 20s, and by 50 years of age, it is usually fully developed. Those mainly at risk are individuals who have immediate family who suffer from this disorder. The treatments vary. The biggest treatment is medication. Usually, an individual that suffers from this disorder is asked to be monitored by a psychiatrist, and this doctor will prescribe the medication needed. Usually, the treatments are similar to those for bipolar I disorder, but due to the high levels of depression, the prescriptions are focused mainly on antidepressants and mood stabilizers.
What is psychosis? Psychosis is the experience of loss of contact with reality, that it is not part of the person's cultural or religious beliefs. A person experiencing psychosis may not know which of their feelings and thoughts are real. They believe the false experiences are actually happening. This could include experiencing hallucinations, delusions, or flight for ideas. Hallucinations include seeing things that other people don't. You may also see objects that appear disordered or that move in ways they normally wouldn't. Experiencing tastes, smells, and sensations that have no apparent cause, or hearing voices that other people don't. Delusion. A delusion is a belief that other people do not share. For example, you may believe you are closely related to the Queen, although you don't share any relatives. You may think you are a very important person. For example, you may believe you are very rich and powerful, or control the weather. Some delusions can be extremely frightening and make you feel mistrustful or threatened. For example, you may feel that something or someone is trying to control or kill you. These ideas are called paranoid delusions. Flight of ideas is when your thoughts move very quickly from idea to idea, making links between things that other people don't. You might lose control of your words or link words together because of what they sound rather than what they mean. What causes psychosis? Physical illness or injury, drugs, hunger, lack of sleep, bereavement, abuse or trauma, spiritual experiences, and family inheritance. Psychosis is not given as a diagnosis on its own. If you experience psychosis, you may be given one of the following diagnoses: schizophrenia, bipolar disorder, schizoaffective disorder, paranoid disorder, delusional disorder, and severe depression. Psychosis can happen to anyone, and it can be treated. Up to 6% of all people will have a psychotic episode at some point in their life. Some treatment and support available are talking treatments like counseling, cognitive behavior therapy, and psychodynamic psychotherapy, as well as medication like antipsychotic drugs. You may also need art therapies such as art, music, and drama therapy. Or if you have repeated or long-lasting psychosis, you may be referred to community care services to help you cope.
In conclusion, mood disorders, although they can interfere with our daily activities and normal routines, they are not a disability. We have spoken about 4 of the most common disorders, their symptoms and treatments. We hope this information and video has been helpful to take into account for one's mental health and that of others, as well to understand and be sympathetic. Overall, there is no doubt that more research is needed to be done but having basic knowledge can help manage and cope with these different psychological disorders.
We want to encourage everyone who may be struggling with mood disorders or its effects to reach out for help. Please feel free to copy or take a picture of the screen in which we are showing hotline numbers. Thank you for watching.